In the year of 2020, thousands and thousands of people have been affected by the COVID-19 pandemic, both in and outside of the United States. Despite the huge amount of people being affected, hospital waiting rooms are filled with black and brown people in masks, waiting to be tested or waiting for treatment. The COVID-19 hotspots are areas heavily populated by people of color. Now, why is that? Most people learn in their history class that segregation plagued America in the past, and it still has lasting economic effects to this day. But one thing most history classes forget to teach is how segregation not only affected towns and cities in the South, but also in the North, especially in Boston. The main difference is that segregation in cities and towns in the North, such as Boston, was not created by Jim Crow laws like it was in the South, but a big factor that helped create it was by policy our very own federal government made. This collection of policies that history classes often forget to teach is called redlining. Redlining may not still be in effect today, but its consequences for the communities of color, especially those in Boston, were disastrous, and not only in an economic way, but it also greatly affects their health. Today, we will be talking about how redlining affects the health of the people of color in the communities affected by redlining in Boston. Hello, I'm your host, Mitchell Bove, and today we will be talking about the health effects of redlining in the city of Boston. And now we will introduce to you our co-hosts.
Hi, I'm Max Ballou. I'll be focusing on the history of redlining.
I'm Adrian Silva. I'm focusing on the medical aspect of redlining.
And I am Kim Castle, and I'll be focusing on the solutions.
So, can you tell us more about the start of redlining for maybe those listening who don't know about it?
Yes, so the start of redlining happens around the 1930s when the New Deal is creating all of these relief agencies to help boost the economy. The issue is they were creating an economy that helped white Americans and really no one else.
Can you describe one of the processes that left non-white people out?
Yeah, so the New Deal created the Federal Housing Administration, or the FHA, which was supposed to increase America's housing stock and give loans for people to move into these new suburban houses that were being built. But as part of the agreements to exclude people of color, they placed racial restrictions. So white families who were receiving loans from the FHA couldn't sell their homes to black families. But the actual red lines, which is where redlining gets its name, are based on the grade that the FHA gives to where they're providing loanings to acquire the new housing. So Boston writer Sandra Larson kind of describes the process of redlining when she wrote, "White neighborhoods and suburbs were typically graded A, so that means that they would be able to receive the loans, whereas predominantly black neighborhoods and neighborhoods with even a few black households receive grades a D. So black Americans would have harder times getting loans. And in fact, between 1930 and 1950, 3 out of 5 homes that were purchased in the United States were financed by the FHA, but only less than 2% of them, of the loans that were given out, were made to non-white home buyers.
Okay, so in today's age, who and how does redlining affect Boston?
In today's world, redlining causes many medical effects, which Adrian will address later. These mainly affect the people of color living in these areas that were redlined, but they can also cause long wait times in hospitals, affecting everyone who lives in Boston, and also create longer workloads for all the healthcare workers who work in the Boston hospitals and the surrounding area.
So now that we know the history of redlining, what are the medical effects of redlining in Boston on these citizens, and why and where do they occur?
So while redlining itself might be an out-of-date practice, it doesn't mean its effects are over with. As a result of redlining, the cities are still heavily segregated by race. Even now, when schools are integrated, many areas are still minority majority. Um, Common health issues found in formerly redlined areas are asthma, birth defects, heart disease, respiratory diseases, and even in current day, issues like COVID-19 and the pandemic that's currently going on. These connect to formerly redlined areas in specific because these segregated locations are often people of color, Black people, or Indigenous people. In fact, Dr. Daniel Farber says 7 in 10 people of color are more likely to live in more medically dangerous areas versus 1 in 100 white people. And the trend with the areas like these are poor living conditions, overcrowding, and waste dumping as a result of the lack of interest and lack of support given to these cities while redlining was the main practice. So these residents will be dealing with inadequate living spaces, cramped housing, vermin infestations, and the closer, larger cities dumping their trash into the area. Along with these, people of color areas are surrounded by various types of pollution causes, like nuclear facilities, landfills, and factories. For example, the Environmental Protection Agency conducted a study finding that Black Americans are subjected to higher air pollution rates than white Americans as a result of their locations. These cause the aforementioned medical problems in these areas. Some cities, for example, Chelsea, Massachusetts, a tiny city close to Boston, are homes to suppliers and warehouses that have trucks coming in and out on the regular, causing dangerous air pollution rates and high rates of asthma. The disparities between these formerly redlined minority majority areas and these heavily white populated and middle class areas are massive, and the only excuse is environmental racism, a factor that must be handled.
Adrian, I know you spoke to an expert on human rights and medical issues. Can you tell us more about what she had to say about the COVID-19 pandemic?
So we interviewed Suffolk professor Amy Akagian. She focused specifically on segregation as redlining isn't her forte, but since redlining is one of the major factors for the existence of segregation in the North, she was still rather informative on the subject. She mentions and makes points about how these segregated, mainly people of color cities are often ignored with their medical issues. She gives insight as to why the COVID-19 pandemic has become such a big issue in these areas. She lists pre-existing medical conditions, such as asthma, for one, as a reason. She also mentions how workers in these areas are unable to miss work because they are the essential workers that the country has decided need to continue to work. They're also working physical jobs that don't allow for them to work at home. And also, with them being paid so little, they can't afford to miss work in the first place once they're sick.
So, Kim, in what ways can the negative health effects in these communities be minimized?
So first, a big step that should be taken is to minimize the carbon emissions and other air pollution in the areas. This will help to minimize respiratory diseases. So a way to do this is to increase public transportation and to have the industries that make air pollution either become more environmentally friendly or to move them away from residential areas. Another way is provided in the Boston 2030 plan. A goal the city is trying to reach is to understand the root causes of the persistent disparities in health outcomes. In the section Health and Safety, the city says that they will take note and collect data concerning the health conditions, birth outcomes, and other health-related issues and use it to address the social cohesion, racial equity, and economic mobility so that the city can improve the health and wellness of the neighborhoods. The 2030 plan also says that they will want to make improvements to neighborhoods and make them a healthier place to live. They plan to do this by improving the indoor and outdoor air quality, increase response times for emergency services, and make more healthier, affordable food available to the people. By implementing these, it will greatly benefit the neighborhoods because they will have better access to health facilities that they haven't had the best access to and receive better treatment.
So, as we learned, redlining has not only affected communities of color in Boston economically, but it also has had a terrible effect on the residents' health due to poor living conditions, lack of funds to pay for health care, poor access to healthcare, and increase in pollution. Again, some of the health issues that are prominent in these communities are asthma, birth defects, heart disease, respiratory disease, and now the COVID-19 pandemic. To all the listeners, we hope you learned a thing or two, but more importantly, what is it that you're now going to do with this information? With this knowledge, it is up to you to be the change you want to see in your community. Start a conversation with your peers about redlining's health effects. Write letters to the city council and other local politicians to make them aware and to advocate for change, and also support plans that are already in place to make Boston a better and healthier place for all its residents. Thanks for watching, and see you next time.